Vertigo. What's vertigo?
Vertigo is actually, some people call it a diagnosis. I have vertigo. And vertigo is actually is a symptom. Vertigo is room-spinning sensation, or it's a sense of motion when actually not moving. And vertigo can be caused by various things. The inner ear, which is our balance organ, and we have a balance organ on our left and right side, can be the source of vertigo.
Okay, is there any treatment for vertigo?
Depending on the cause. One of the most common causes for vertigo is something called BPPV, and that's an acronym for benign paroxysmal positional vertigo. And that happens when you have room-spinning vertigo, or the sense of motion when not moving, that lasts usually under a minute. And it happens usually with head motion. The most common common description is when rolling over in bed. When you have a motion of the head to one side, room-spinning vertigo ensues, and then it lasts about a minute or so, a little bit less, and then you're able to kind of re-equilibrate after that.
But most time it does go away without any treatment, but sometimes it persists. At what point when it persists will you have a little bit of a red flag and maybe you would be involved?
Sure. Vertigo, persistent vertigo, like we described with benign paroxysmal positional vertigo, that occurs over and over again and does not exhaust, does not go away. You can seek evaluation by an otolaryngologist, in which case repositioning techniques can help solve that. That's a simple procedure done in the office. Vertigo that comes and lasts longer, meaning longer than 2 minutes, if it's lasting for 20 minutes or 2 hours. And some people, it can last for days. That's times when you want to seek medical attention.
Are there any times you have to do a MRI or a CAT scan of the head? There
sure are. Vertigo that is lasting greater than 2 minutes, or lasting for minutes at a time or hours at a time, and if associated with, especially with a hearing loss, an MRI is often indicated.
Is there any type of tumor that could be associated that's common with vertigo?
Sure. There is a tumor called an acoustic neuroma, or the more correct name is a vestibular schwannoma. That is a benign tumor that grows on the hearing and balance nerves, and that can cause vertigo. The most common presenting symptom for that is ringing in the ear, tinnitus, like we previously spoke about, and hearing loss. However, as it gets larger, it can cause vertigo.
How would you treat that?
That after diagnosing the tumor, depending on the size, it is treated by various means. Nowadays, there are surgical options and there are non-surgical options. The non-surgical options would include watchful waiting to see if it grows. Like we said, it is a benign tumor, and if it's very small, and depending on the patient's age, it sometimes can be monitored with follow-up MRIs on an every 3 to 6 month basis. The surgical options would involve resection, which usually is done by a neurotologist and a neurosurgeon.
So it's not a simple surgery, is it?
It's actually a very complex surgery. However, it's in this day and age is done very safely.
And I would seek out a center that's not someone does it once every 2 years, but someone does it on a regular basis.
Correct. This should be done by an otolaryngologist, or that's a neurotologist who does ear surgery and skull-based surgery, and a neurosurgeon.